Let's get to our big story now and talk about COVID, masks, and the requirement that you wear those masks indoors or out regardless of your vaccine status. Oregon is one of 6 states at this point with an indoor mask mandate and one of just a few with that strict outdoor rule. And a lot of you have emailed and messaged us basically asking why. Barbara wrote, "Have you heard whether Governor Brown plans to update anytime soon regarding how long she will maintain the mask mandate?" She added, "It would be helpful to know the latest stats that drive her decision to continue." Barbara, great question. So here's the thing. Hang on to your hat. You don't have a hat? Get a hat. Hang on to it. It turns out Oregon does not have a specific, tangible set of metrics for ending the mask mandate. There's no tangible set of metrics at all. Pat Doris talked with an outside expert and a local county commissioner who say, yeah, we need that goal line.
Remember back in June when Oregon Governor Kate Brown declared the state open for business?
Oregon is 100% fully open.
It brought an end to most COVID restrictions because the state had come very close to hitting a key metric. 70% of people who were eligible for COVID vaccinations actually got the shot. That metric gave a clear target for the public to focus on and to know when the restrictions would end. Unfortunately, it did not last. The Delta variant soon took over and turned everything upside down. Oregon eventually put mask mandates back in place again for both inside and outdoors. But this time the state did not say what it would take to drop those rules.
Do you think it's a mistake that Oregon doesn't have any metrics for getting rid of this mask mandate?
Yes, I think it's a mistake that Oregon doesn't have metrics.
Dr. Monica Gandhi is an infectious disease doctor and professor of medicine at the University of California, San Francisco. She said a lack of metrics threatens the public trust.
It is imperative that we retain as a populace trust in public health officials. When mandates are put into place for public health emergencies, they have to be accompanied by metrics of when they come off and what constitutes a reason to come off. Otherwise, I am worried that it looks like restrictions without clean data-based metrics.
I completely agree with that.
Sharon Myron is a Multnomah County Commissioner and a medical doctor. She is also worried about a lack of clear goals for ending restrictions and thinks the outdoor mask mandate, which among other things requires masks anytime you cannot stay 6 feet away from people not in your household, that it has outlived its usefulness.
Do you think that we should be dropping it now?
Well, from what I can see, when it comes to wearing masks outdoors, the evidence suggests if someone is vaccinated and they're in an outdoor setting, unless it's literally standing room only, there's a very low risk of COVID transmission, even when people are unmasked. So I would say unless the state can show me the evidence of why they're not lifting the restriction, that it should be lifted.
The state did not have anyone who could go on camera, but state epidemiologist Dean Seidliger said a statement essentially saying that it's difficult to come up with specific metrics this time because the virus could change and is unpredictable. He said the Oregon Health Authority is watching hospitalizations for COVID, hospital capacity, and case rates, and that they need to go down more before restrictions are dropped. State Senator Elizabeth Steiner Hayward, also a medical doctor, thinks it is reasonable for the state to move slowly.
I think the state is being appropriately cautious to say, until we're confident that our immunization rates are high enough and our case rates are low enough, setting metrics may make people more careless.
Multnomah County's public health officer thinks it is important for the public to know what it takes to drop the mandates.
Yes, I do worry about that because I think the public deserves to have some sense of where we are and where we're headed.
Dr. Jennifer Vine said the hard part is coming up with those metrics, since breakthrough cases may elevate a case count, but those cases may be less severe.
I generally foresee continued use of masks through the winter. I do think that as we think about peeling back masks in particular, I think stopping outdoor use is a great place to start. Masks are much more important for prevention indoors, much less so outdoors.
All of which leads back to Dr. Gandhi's main point. Tell the people what it will take to end restrictions.
But where you lose your trust is when you sort of indicate that there's a prolonged public health measure restrictions without cleanly telling the population, when do they come off? What is it, a vaccination rate plus a hospitalization rate? Is it linked to the availability of the child vaccine? Just give clear metrics. If we lose our trust in public health officials, we have a lot of other public health things that we have coming up that we need to trust them.
Pat Doris, KGW News.
So one more note on this topic, because as long as the state's mask mandate is in place, that means that OSHA can fine workplaces who either fail or refuse to follow it. And this week, they handed out a big fine to a tiny school district. It's in Eastern Oregon, specifically at the town of Adrian at the Idaho border, and the Adrian School District got hit with 4 violations. OSHA citing anonymous complaints of students not wearing masks. Most of these came with fines between $100 and $420, but one of them was a willful violation, and that means OSHA says they demonstrated either intent or purposeful disregard for requirements, and that cost the district $10,500. The district told us they are appealing those fines. And you may remember back in August, the Adrian School Board actually fired their superintendent, Kevin Purnell. Board members wanted Purnell to defy the governor's mask mandate, but he refused, and he was voted out. A new superintendent started just this week.